skin prep. So I've gone ahead and I looked at my patient's record, and I know what the supplies are required for the dressing. I've been in the patient's room earlier and I addressed the discomfort, so the patient's medicated. And I've looked at the information on the medication, so I know that in 20 minutes the medication will have taken effect. So I want to make sure I'm in there in a timely manner. I want to make sure that I ensure privacy for the patient, that I have adequate lighting. I want to make sure that I save my back, that the bed is brought up to the proper height. And I want to make sure that I have plenty of supplies. If not, I have a call light that's close by that I can call for some help, right? That's important because things happen. I've set up my supplies, so I've set up my tape. And one thing I've also set up is the date and the time and my initials, because I want Nancy Nurse that's going to come on at 4 o'clock that I've changed the dressing. If for some reason that person didn't have time to look at the documentation. All right, so my patient is medicated, and I want to be gentle with this tape, and it really does adhere to the gloves. So basically, pull or push. So I'm just going to take off the ABD, and I would look at it for any kind of drainage and make a mental note, and then my 4x4s. So this is fairly shallow wound, and basically most of our wounds are very shallow. But I would annotate all those characteristics we talked about. So get rid of it in my bag. So what do I need to do next? Change my gloves. I brought enough gloves, right? We'll see. We'll see. Hand cleanser. Clean gloves here. So I want to measure the length. So again, this is approximation. So it's approximately about 12 centimeters in length. And about 2 centimeters in width. And then what would I need to measure the depth? A cotton tip, yeah, cotton tip applicator. And then depending on the depth, I would just place it against, or not directly against it, but near it, to measure the depth of the wound. All right? Okay, so I again would make a mental annotation of this information. And then what else do I need to do now?
Change your gloves. Change your gloves.
Yep. Okay. Right. Okay. ask my patient just to move over a little bit so that I have some room. So, when you open your sterile field, so basically, remember the blue side is the dirty side. So that's gonna go ahead and be on the table. So basically, it does have the very end here, so you can touch this because that's not going to be the side that you're gonna work on. But remember, this field is a lot larger than the CVAD field. So think about it and how it's going to come down, because you want to keep it above your waist. And just work with it. Remember, you have an inch border, right?
Mm-hmm.
And you can work around the field. So make sure the blue is always going to be against your chest, because you want to make this as clean a job as possible. And I like to use it long side so that it doesn't now ideally,
The tables in the lab are smaller though.
well, you're right.
I was gonna say, so is it okay? So
But
if
you're
it
gonna
falls
have, but
down-
you're gonna have all the table. That's the good news. I don't have all the table.
Where is the wound gonna be? In the bed?
Yes,
Okay. Oh, okay.
yeah,
That's good, yeah.
yeah. So I'm basically going through what you all did with the CVAD dressing, right? But I had it too on here. Anyway. So as you see, it's a little bit raised in the, you see it's a little bit raised in the middle of the field. Don't worry about it, because you're gonna put all your dressings on it, and it's gonna work out. So what do you think I should put on next?
You have to put your supplies on your supplies.
Right.
Put your supplies on your
Yeah.
bowl.
So let's open the bowl. Did you all have an opportunity to open up the bowl?
Yeah.
There's gonna be all pros then. So basically the bowl is pretty easy to open up. It's on the corner and it really does, well, at least this one is, open up easily. Now these bowls, you're gonna have to practice with for the whole week. So don't go to Sharon asking for more supplies, which is not gonna give it to you. You just have to remember to keep this white paper controlled, right? Because you don't want it dropping out and contaminating your field. So basically you want the bowl out here. And I like to put it on the edge, you know, within the 1 inch border. And why do you think that?
Closer to you.
Dump your saline.
Yeah.
Right,
So you can still.
right, and also if I'm cleaning it, I'm not gonna drag it across the field. And also this could be another little place for disposal, right? All right. Now typically in the past, we've had students open the 2x2s. And they're, for some reason, these are not as easy. I'll open up a few of them, but Sharon and I were opening them up this morning and they weren't real easy. They were really tearing up pretty bad. So I didn't know whether I could use them or not. So I wanna make sure that I have enough 4x4s, so that I have enough to clean and dry the wound, and also apply at the very top. Really got that one in, right? Let's see if I have any more luck with the 2x2. Actually, these aren't too bad. They were a little
Yeah,
bit
you got
tougher.
lucky.
They were a little bit tougher in the lab, but it was pretty hot in there, so.
Remember the one that was on six months? Remember the top, yeah. So you don't have it. With the baby wool.
Also, each package actually has 2 ABDs in it. So if you keep that in mind, depending on the wound, as to whether you need more or less. Another one. Okay, so, Ada, don't forget your ABD, right? Done that before.
And if we do, can you just tell the validator to put it on our field?
Yes, you can, absolutely.
So my friend.
And I've got my skin prep, and I'll just have somebody hand that to me when the time comes. Put another ABD on for good measure. And then we'll 4x4. All right. All right, so I've got my 4x4s, I've got ABDs, I've got the skin prep right here, and got my tape on the side. I need my saline, so let's get this. Okay, I'm gonna put my palm here. I wanna be very careful that I don't spill.
Does it have to be a certain height above the bowl or no?
I think it does. It says height.
Yeah.
Yeah. You don't want it too high
Yeah,
because it will
splash.
splatter
Yeah.
out, so just keep that in mind.
Right.
So then after I finish with this, as you all told me, label a date and time, that sort of thing, so that's good. If for some reason you had the opportunity, it does mention using forceps in the validation. Depending on our supplies, we may have them available, but you can always open up these kits. You may need it, depending on the type of wound that you have an opportunity to change. So I have that. All right. Did I forget anything?
I don't think
Probably
so.
not. We'll see. All right. Hand hygiene.
Now you put your sterile glove.
Oh, and these gloves are hot. They are
Ada,
hot.
how many 4x4s did you place in the field? Just so we know, like, when we're grabbing supplies.
I think I opened about 4
4,
packages,
yeah.
at least 4. You know what, I would always go with more than less, just to have some extra ones. All right, hand hygiene, I've applied that. Open up my sterile gloves. I have a little place here, but you guys can't see me, so I'm going to apply it here. Actually, you know what, if you keep your, can you keep your books here so folks can just see my sterile glove? Thank you very much. Okay, so I'm gonna open up my packaging. And I know some of the packaging last week was a little challenging in that it wanted to close back up.
You can just,
Just kind of work with it. So my sterile glove, I want to go inside my glove. And always bring extra gloves because these are gifts to us, so they might tear. I've certainly done that several times before. Now, before I forget, because I didn't mention at the beginning, I have my sleeves rolled up for a reason. So when you have an opportunity to validate, that's not the time to wear the long, loose sleeves. Now, it will be after our spring break, and hopefully it'll be warmer weather, so your sweaters might not be worn, but just keep it in mind. Also, I have, for longer hair, keep it back so that you're not having hair fall over on your field. All right, so what do I need to do first? So I want to clean the wound. So I have my skin protectant here. So I'm going to have plenty of dressings. And it's such a small wound. Now, there are a couple of different ways that you can clean the wound. If it was a really large wound and it was deep, oftentimes you have to clean it from the inside and then clean the outside. Don't let me forget, I want to show you those pictures. So basically, if that was required, you would need actually 3 dressings. So you could typically clean this wound with 1 dressing because it's so small. But say it's a larger wound and required 3 4x4s. So basically you want to go from top to bottom, right? And then go ahead and discard it.
Three times, right?
Correct. So I'm using my left hand to get it from the bowl, and my right hand is going to be touching the patient. And then top to bottom, discard it. And then top to bottom and discard it.
Okay.
Now I could have just used 1 dressing, 1 4x4 to clean it, but I wanted to show you that technique because that is in Taylor. So if you're going to dry it, basically if you did the 3-way, you would dry it in the same manner. So basically you would go down the middle, dry it, and then get rid of it. Dry it, get rid of it. Dry it, get rid of it. All right?
Won't the dry gauze stick in there?
Will it stick?
Yeah.
And
raw?
when you
it's
when
fine?
you are initially removing the dressing, so when I removed the dressing, it had the ABD and then it had the 4x4s. Typically, that's what's going to stick.
Okay.
So if it does stick, and it says it in your validation, you can apply normal saline, and that loosens up the gauze so that you can easily pull it away from the patient. Okay, so now the wound has been cleaned and dried. What do I need to do?
Sterile.
Yeah. Oh my goodness. Okay. So am I going to be so lucky to actually not tear my gloves again? We'll see, right?
Yeah, my hands are so dry.
Yeah, no kidding.
No.
I'll see my hands. in terrible shape. All right. All right, so let's do it again, right? You guys are gonna be pros with this.
Yeah.
You'll be going into wound care, right? The old hat.
So if we have our sterile field on the table, where can we change our gloves? Because it'll take up our whole table.
So with one corner,
Use a different table.
You can use a corner of the table, or just ask your evaluator.
Okay.
They'll be open-minded about it. Okay, so inside of the glove, looking for my thumb, apply it, and then outside of the glove, outside, put my hand in. And the home stretch here, we're almost there, right? Okay, so I'm going to apply my 4x4s, and depending on your wound and the contour of your wound, the depth of your wound, you're going to apply appropriate dressings. So basically, here and here. Oh, but you guys didn't remind me. Look at that.
the skin.
Skin protectorant.
And before you put the dressing on, would that be the time you put like the medication?
Absolutely. Absolutely. Which is a very good point. So if you have medication, so actually a very good point was made. If you have to apply medication, you would basically apply it to a 4x4 and then apply it to the wound. Yeah.
The critical step, what if we forget? No, we
You
will not.
won't forget. You won't forget. Because actually this is going to be given to you by your evaluator. All right. So where do I want to apply the skin protectorant?
Around the wound.
Right, right. I don't want to apply it on the wound.
Does it have to go from top to bottom, as long as we do the outside, it doesn't matter?
Yeah, the outside, because it'll be outside the wound on the good skin. All right, so here is,
I have a question.
yep,
If it's a deeper wound and we have to,
pack it.
pack it with the 2x2 or
Yeah.
4x4, we have to pack it on the edges or the.
So that's a very good question. So do you mind if I remove this dressing? I want to show you all that. So if you had to pack the wound, typically what you would do is, depending on what's ordered and also what the size of the wound is. So for instance, if you're packing a very small wound, very small opening, you would use 2x2s. However, if you're packing a large wound, you would use 4x4s. Or I've even seen cling or Kerlix shoes, depending on how large the wound. I've seen huge wounds. So that's really going to dictate the type of gauze that you pack the wound with. So basically what you would do is you would squeeze out the excess solution. And what's so nice about the gauze is that it really, it has these little threads in it. And the thing about packing a wound is basically a debridement. And the wound heals from the inside out. So when you pack it, and this is where we would have the cotton tip applicator also, that would be very helpful, because that would help you kind of guide the wound. Yeah. And depending on it, you can, remember, you can manipulate these gauzes however you want. You could have them spread out and a lot more, or you can kind of twist them depending on how narrow your wound is. You can use a cotton tip applicator to kind of help encourage the dressing to go where it needs to go. But one thing you don't want, you do not want, and I would have to apply it on the very end there. You do not want this wet gauze
stays at the edges of the wound because
Right,
it will not
outside
let it
the,
heal. Okay.
exactly, outside the edges of the wound. Because the skin will break down, and you don't want that to happen. So typically, that's what a packing would be like.
Yeah.
So you would say within the confines of the wound edges itself, and then you would apply your skin protectorant, and then you'd go ahead and apply
We'll try gauzes and
your gauzes. And your ABD. Those are good questions. So I think we've got enough of these suture kits that we'll have them available, so you all can use that. Because some of our wounds are a little bit more shallow than others, but they're, I mean, none of them are really very, very big. Okay.
At this point, are we technically still sterile?
No,
No.
nope.
That's what
So you're almost at the finish line.
I was gonna say, I was like, wait.
Home free.
if you wanted, could you take off your sterile gloves and put on normal gloves?
Absolutely, absolutely. And you really might have to, depending on if the skin barrier sticks to your gloves and it's real sticky. I've had that situation. So, all right. And
For date and time.
Yeah.
Mm-hmm.
do I want to do my John Henry on the patient?
No.
My ink pen? No.
He brushed his it.
There we go. There's my John Henry. Nancy Nurse. All right. Any questions?
No.
Okay. All right.
Yeah, it takes easy.
You guys have got
Yeah,
this.
that's it.
Yeah.
That's not bad. This seems like the easier one.